know, this is all about community medicine. If you are new to this channel, then please do subscribe because subscribing boosts me up for more academic contents and to keep you on the toes for your exams or your entrance examinations or your professional examinations or for just getting yourself conceptually right. So this time it's in the exam ready series, and this is a follow-up to the community medicine theory examination prep up for the paper 2 for the upcoming third prof part 1 examination coming up for all those who are all stressed up. So let's see how are this paper 2 sorted about. This involves the family planning and demography, the maternal and child health, nutrition, social sciences, occupational health, communication, genetics, planning and management, healthcare delivery, and international health. Now coming to the first part, that is family planning and demography. Remember, repeatedly I'm telling you in this new CBME curriculum, the assessment is based mostly on the applied aspects. So less chances of getting direct questions, more on the problematic, problem solving, analyzing, applying those aspects. So the basic topics remains from the point of view of importance the same, but how the question is placed to you and how you need to answer them, that differs to a certain extent. In this chapter, what matters are the demographic cycle, and of course, in context of India, where it is, why it is so, if it is progressing to the next stage, and why so, are important. The another thing is the dependency ratio. How to calculate it, what's the significance, the fertility indicators, you should be able to tell all about it, the different family planning measures, there may be case-based counseling regarding family planning. Always remember, counseling has to be through the gather approach, and it is always a facilitating process and never a forced or okay, this is what you are supposed to take. It's never like that. It is a facilitating process where you give them a choice, and based on that the couple take a informed decision. That should be always at the back of your way you are writing your answer to a family planning problem. And in this context, it would be also nice to know the definition of eligible couple, target couple, couple protection rate, net reproductive rate or NRR, the significance of each of them, what is India striving towards in achieving each of these, the different contraceptive devices in terms of temporary and permanent ones, what are the pros, what are the cons, who are the ideal candidates for each of them. You'll never be, really these days asked in theory that who is the ideal candidate of IUCD, which you may be asked in the Viva, but it would rather be, maybe Seema is a, recently married woman and she came to you not wanting child anymore. Husband is not cooperative. What is the family planning advice you'll give and why? There you have to justify, and that is the point where you need to have the knowledge regarding all these. Then the Pearl Index for assessment of the different family planning or contraceptive measures in terms of their failures per 100 women year. Now coming to the next chapter, there's the maternal and child health. that is mentioned in your PARC as the preventive medicine, obstetrics, pediatrics, and geriatrics. So here you need to know the major maternal and child health problems in our country. The problem given may be, the question given may be around antenatal or postnatal case based. The such and such woman has come in such a week of pregnancy or after delivery, coming at such and such with such and such problem. How will you solve it? So for that you need to have a good understanding of this section and what are the basic services given in the ANC and the PNC period, so that you know that when you are writing this you have to suggest all these steps. The risk approach should be very clear to you. Who are the high risk mothers? What are the warning signs? The concept of breastfeeding, the advantages of breastfeeding, the pros and cons of artificial feeding, that is bottle feeding, the baby friendly hospital initiative. How is it being implemented? What are the things that needs to be more strengthened in this aspect? Then of course neonatal care, the different cleans, the at-risk infant, low birth weight babies, the different causes, factors leading to low birth weight, how you can get the low birth weight lowered as the medical officer or the block medical officer or epidemiologist. So there may be varied applied aspects from that. So the warning sign may be coming as short note as well as you may have to write down the warning signs that the antenatal mother needs to be warned of the following signs when she is coming to you while you are writing the answer of management. Beside this, kangaroo mother care is a very commonly asked short note. So you should be aware of this, the advantages of it, why is it used, what is the main purpose of it. The growth chart is a very important part of it. What is the significance of it? Both WHO and the ICDS one. The different reference lines used to define the different zones should be absolutely known to you. And how is this growth chart used, the uses of the growth chart? That it is also part of the GOBI FFF initiative of UNICEF, along with ORS, breastfeeding, immunization, and others. The different mortality indicators of infancy and childhood. This is present in the paper 1 as well as in the part of the paper 2. And it may be so the MMR has gone very high in your block, and how will you take it down, what measures you will adopt, how will you prevent and manage the situation. So things like that. Then school health service is again important. What are the objectives of it? What are the services under this? You should be knowing this. Then juvenile delinquency for ages has been a very favorite short note. Adolescent health care, the different programs catering to it. Then management in case of aging population. And another thing, let me re-emphasize, that is the national health programs in the revised CBME doesn't enjoy a separate chapter, but what it does, that it is used as an integrated part of each of these chapters. So whichever faction has its national health program, it is dealt along with. So when you are doing this MCH, it is important for you to go through the relevant national health programs. So you should be knowing the GSY, the other programs relevant to all these, RMNCH plus A. Nutrition, it is very important to know all the macronutrients and the micronutrients, their roles, what their deficiency or excess will lead to, the nutritional anemia, the concepts of it, how is it caused, what are the classifications thereof, the different nutrients when we talk of, like Role of dietary fiber in diet. Role of vitamin A in the diet. What are the deficiencies caused due to vitamin A? Both ocular and extraocular ones you should be knowing. Then the role of balanced diet, what it is, how can you constitute a balanced diet of maybe a pregnant woman, maybe a lactating woman, maybe a medical student. It can be of varied nature. Then this food pyramid again is an important concept, that which food groups and how are they arranged throughout the food pyramid. The different classification of protein, energy, malnutrition that involves kwashiorkor, marasmus, and of course the SAM children management is also very important. And nutritional surveillance, how is it done? Since this nutritional survey is also a part of your family visit, and there you do the 24 hours recall method, so you may be asked to undertake a nutritional surveillance, how you do it, what are the methods, what are the pros and cons, and things like that. Then the pasteurization of milk, food intoxicants, food fortifications, the community nutrition programs. These are also very important areas to go through. And in this context, the midday meal scheme and the midday meal program, these are very important things that how are they really different. It is nothing but that program is the basic tenet, and the scheme is how you launch that program at the ground level. So if program says this is to benefit the those children, to complement to provide them the supplementary nutrition, then midday scheme is providing them this much protein, this much percentage of the RDA of the food in that school level through their midday meal, how to do it, where to do it, who to take care of. So that is the basic difference. So apart from these, we come to the social sciences. Here the concept of society, community, acculturation, the different types of learning, the different domains, the types of family and functions, which you are pretty aware while you make those family visits. Those are even asked in your theory these days, that how family is the epidemiological unit of the society. Given the ATCOM situation, the doctor-patient relationship, the attributes of an Indian medical graduate, the doctor-nurse relationship, these are the counseling skills. These are also very important part of it. But these mostly, since the ATCOM question, these are made compulsory in the paper one. These are more into the paper one. So the Global Hunger Index, the Social Security for Industrial Workers in the form ESI, Indian Factories Act, these you should definitely go through, that what are the benefits available under each of these, what are the services that one gets from it. So these area you should be absolutely well conversed about regarding the social security part, because these days there is a lot of emphasis on these things. Now coming to the occupational health. Here the occupational hazards, the occupational diseases like pneumoconiosis. What is pneumoconiosis? What are all that falls under pneumoconiosis? The factors affecting, how to prevent and control are of paramount importance. This concept should be crystal in your head. Then sickness absenteeism in the form of short notes. The difference between periodic medical examination and pre-placement examination. What is the role of each of these examinations? For the prevention aspect of the different occupational diseases, do try to construct your answer in terms of medical measures and engineering measures. so that your answer looks more organized instead of just generalizing the measures. Again, I'm reiterating that here also the Indian Factories Act, the provisions made under it for each of the categories like the females or others, ESI Act, the scopes, the benefits should be absolutely crystal. Now coming to the communication part, that is communication for health education. Here the communication process, the different channels of communication, the different types of communication, barriers. Counseling is coming across more and more as a very important component which is being stressed upon in this new curriculum from the applied point of view. So get a good understanding of this, and as well as an understanding what is the difference between health education and propaganda. Now coming to planning and management. Now health planning and management, you have to know the planning cycle, the objectives, the targets, the goals, how are they different from each other. The different methods of management, particularly focus on the network analysis, is a very commonly asked question. Critical path method and PERT. Here there are certain policies which are very important for you to know. At least try to know them in a gist, like the National Health Policy, National Nutrition Policy, National Population Policy, and the health system in the India, that how it is managed. Do remember the rural health care in India is three-tier in nature. So this healthcare delivery, the different levels of healthcare, primary, tertiary, secondary, all should be crystal in your head. The different elements of primary healthcare, what it is, the different principles of it, how it is implemented, the concept of community participation, Indian public health standards set for primary healthcare centers, they should be absolutely known to you. Now coming to international health, the organizations like World Health Organization, what are their functions, how are they contributing, international and Indian Red Cross, how are they contributing, UNICEF, the Gobi FFF initiatives of it. So these things are precisely a very comprehensive guide for your paper 2 to go through the must know areas mentioned here, so that you know which are the places you need to emphasize upon and focus and write your answers in a more concrete fashion. Try not to write a lot. Try to write as objectively as possible. Provide the those flow diagrams wherever it applies. Don't think that writing pages will fetch you a lot of marks. You have to be comprehensive, objective, and your script should be neat, clean, without any fuss. So with that, this is signing off from my side, and thank you very much for being part of this journey. If you're still not tuned in and still not subscribed, please do so. And all the very best for all the days to come. Thank you.